You're watching Newsfeed. Let's pick up on this discussion now. Due to the intensity of load shedding the country is experiencing in the healthcare sector, it's been severely affected. There's been also calls for more hospitals to be exempted from the power cuts. Now, to mitigate against this, the crisis in the healthcare department in Limpopo has procured 11 backup mobile diesel generators, which will be located in strategic areas and will be dispatched to the hospitals when needed. Let's get more now on this, and we're joined by the Limpopo Health MEC, Dr. Phophi Ramathuba. Dr. Ramathuba, thank you very much for your time. Let's start with the positioning of these generators. There's about 11 of them. When you say they will be positioned in strategic areas, which hospitals are being prioritized?
Good morning, Oli, and morning to all your viewers out there. What we simply mean is that, firstly, we have done an audit in terms of the lifespan of all our generators with the recent experience of frequent breakdown. This was as a result that our generators have been historically been there in our facility for the standby, for that 30 minutes day when you will have a challenge. You would see even the frequency of maintenance. It has moved from probably once, sometimes a year, to 6 months. Then currently, even some of them every 3 months, they need to be maintained. So after doing all that work, we realized that sometimes one generator can break down and the contractor will tell you you don't have a part, or takes 2 weeks to fix. And to get a loan or someone to rent us in the process while they're still fixing the broken down one, it takes forever. And the hospitals must run, they cannot survive. So that is why we decided to procure a total of 19. Amongst them, we've already received 11. There are those that already have been earmarked to the areas where the lifespan of the generator. For instance, if you look at as Dr. C.N. Patudi Hospital, the lifespan of that generator, it's not gonna easy to fix it. So we've already connected the pharmaceutical depot where we store all our vaccines in the province, and you can't afford a minute without a power supply. Otherwise, you're gonna have a wasteful expenditure of that stock, which cost millions of rands. So we've already connected. The other one this week is taken to Mkopani Hospital. Remember last year there was a time where we had a breakdown and we struggled until we finally got to fix it. So it will be taken FH Odendal. Just to mention those few, but however, they will be strategically located in the sense that each district of our 5 districts will have a mobile generator that is there for in case when you have a breakdown and you are still waiting for a part to be delivered. This particular mobile generator will be dispatched to assist in the process while we are waiting for the fixed generator to be restored into functionality. Yeah.
MEC, all right. So what you have said so far is that 19 generators have been bought. You have received 11 so far. Because we're talking public money here, MEC, at what cost were these generators procured?
I need to verify to say what was the final, because during the procurement process I was informed that they will cost I think around 43 million, but I need to really verify, because remember it's only when the goods has been received that payment will be done. So we will definitely be coming back to you, but as it is for now, let's look at that 43 million, which was put as the budget to order those generators.
Yeah. Let's then look at the practical sense. So when load shedding hits, the generators kick in. The procedures we have heard that certain procedures, if it's a surgery, for example, that will have to be postponed whenever load shedding hits. With these generators now that are going to be installed, do you think that patients who need urgent medical care, such as a surgery, will be able to get that necessary help?
I think when you have a reliable alternative, a power supply to ESCOM, there's no need for any, whether it's an elective procedure or not. The reason why you saw us procuring a majority of these generators being 500 kVA and up to 800 kVAs, these are big generators. It's to make sure that the setting of a hospital, it's completely different from your household. There are certain machines, for instance, if you look at your theater, your chiller plants that are there that needs to continue to function require more voltage. Your linear accelerator, these are your oncology equipment, require that. It's unlike when you look at the general wards, for instance, orthopedic patients in the ward, they don't necessarily require those equipment. So what you are asking, it's simple to say, we really, with this current equipment that we have, do not have to panic. But it still boils again to the management of facility. The fact of the matter is that every technical service manager, it's expected, before they start their work on a daily basis, to go and check everything, like the pilot will do before they fly you. They will definitely check everything, so that, because the mistake that they can make up there, we are all gone. So every technical service manager in all our facilities, before they even go to do anything, they must check if the generator is in good condition, it's functioning. And we have said to the CEO, you must not sit in your office. At times, you must just go and walk. Don't wait for them to show you a register that we have checked. They can easily tick without having checked. You must at times go and do a surprise visit so that they don't know when will the CEO come and physically inspect. So if you do that, it means when load shedding, the good thing is that with the load shedding is that that guy who switches off never missed time. If they say 10, they rather switch it off at 1 minute to 10. They will never go beyond 10 o'clock. So you guarantee that they will switch off. So at that time when they switch off, your generator immediately kicks in. And then it means if you are in theater, the patient is on the table, there's nothing wrong that will go on. The other thing that we have done, our equipment, like our anesthetic machines, all of them are fitted with what we call uninterrupted power supply. These are the batteries which can push up to two hours, some of them, in case there would be no power supply on their own. They've got those built in. We've done it in all our ICU equipment, in our theater equipment. So we strongly believe as a province, we're in a good space to say there will not be any challenge. Because let's say the generator fails to kick in for whatever reason, that anesthetic machine will be able to continue with the doctor operating. However, we will also be able to have a loan equipment that is mobile out there, the generator, that could be delivered to your facility and be able to allow you to continue to operate and to work in a facility. So no facility must have dark city for whatever reason in terms of poor or lack of power supply.
Yeah. MEC, then let's veer from the energy crisis and talk about water. Now, water in hospitals is something that is simply, you cannot run a hospital without water. There was a report recently that some rural parts in Limpopo were affected. I'm talking about the facilities now. Rural hospitals were affected because there was a water shortage. Is there a crisis there?
I think what you must remember, Toli, is that you can't talk about water supply without reliable energy supply. Because waters, for instance, in our clinics, we depend on boreholes. And for you to pump water from a borehole, you depended on electricity. water in some of our hospitals, for instance, your Elim hospitals, where municipality is not able to meet our demands. We are relying on a supply from boreholes. So we had a challenge in Elim Hospital, I must confess, wherein as a department, because within the hospital facility, all the boreholes that we had drilled previously are now dry. Then we drilled a borehole outside the hospital. Now the municipality also and Water Affairs had another borehole outside. Now the community within that particular area says, how can you have the water pipes passing us to the hospital? There was illegal connection. Therefore, the water was not able to reach the facility. And I must indicate that I spoke to the Minister of Water and Sanitation, and he responded quickly. The team was brought here, and that issue was resolved. The similar issue was there in Malamulele. We also had an issue in Philadelphia Hospital, where also equally they even stole the pipe that was coming from outside the community to supply the hospital. But there, the Deputy Minister of Water Affairs also intervened, and we've been able to fix that. So as we speak currently, where we are having water challenges, we in advance, the CEO must speak to the municipal manager and or talk to me to speak to the mayor, and then municipalities will supply water tankers. The challenge was water that comes with tankers. Unfortunately, if you do not have a power supply, our, for instance, equipment, your laundry machines require that pressure. Your kitchen equipment require that high pressure. So with these generators that were procured, they will also be able to assist that even during load shedding, when municipalities supply us with water tankers, because for whatever reason they can't directly supply us with water, we will be able to have generators that assist us in terms of the pumping of water, and due to that pressure which is needed. So hence I'm saying these are linked. But as it is, the province, it's being properly managed. The team that we work with in the Department of Health understand that we are running the lives of people in the province that depended on us. That is why we are always proactive. And whenever we encounter a challenge, we always come up with a solution that will address that problem. You must understand, we are a rural province, and we serve majority of the poor people who can't afford private health. So in terms of dealing with these issues, we always ahead to make sure that there's no problem that we can't solve as a province, even if we know resources are seriously limited. Like now, the price of diesel that continue to go high, it is a serious challenge, but we are always saying, let's compromise in certain areas where we can do without, but we can never compromise on an area of a shortage of diesel.
Talking about the delivery of services, your hospitals, the understanding is that they would have received a number of ambulances as well. How many ambulances were delivered in the area or the province of Limpopo? And how are you going to spread out these ambulances? And I'm saying this with the Northwest province in my mind. That province has had severe challenges when it comes to ambulances. How are you doing on that score?
Now, we also had a serious challenge when it comes to ambulances. I must also indicate one of the issues which is making deepening this crisis is the fact that the majority of our ambulances stays for a longer period in the repairs. The service provider that have been given the responsibility, which they are not appointed by us, and we are working with Treasury because they are appointed by through the banks that are appointed by National Treasury. So unfortunately, some of the people that are appointed to fix our ambulances, they don't have what it takes. That I must say it up front. We are not comfortable. We are not happy with their services. They will take a vehicle will stay for 6 months in repairs. So that is another area which we need to strengthen. And working with National Treasury, we know and our provincial treasury. This matter will be resolved very soon. You cannot keep an emergency medical vehicle in your repair like you are keeping my private car. I can have alternative way of traveling, but patients will never have alternative way of being transported to the hospital. So that is one challenge. The second challenge, if you look at the geographic spread of Limpopo, being rural with all our roads challenges, that's why our vehicles, they do so many kilometers. An ambulance to move from Musina to Polokwane twice a day, coming in and out a trip, getting to up to 600 kilometers on a daily basis, the lifespan becomes very limited, unlike in other provinces where the hospitals, tertiary hospitals and district hospitals could be 20 kilometers apart.
MEC,
now, what we did...
MEC, let me interrupt you for a second. Can I interrupt you for a second there? You seem to be very aggrieved at the slow pace that these ambulances are being fixed, at least the ones that need fixing. One, who is the service provider and how long does it take perhaps when an ambulance is sent in for repairs today? How long would it take to come out of the garage?
This is the area. I don't know who are the service providers because, as I've earlier indicated, they are not appointed by the department. But the reality is that some of these ambulances could take. There's an ambulance that has been in for repair for more than 6 months now. You can see that some of the ambulances will take up to 3 weeks. Some will take a month. So starting from 2 weeks, 3 weeks, up to 6 months, 7 months. So that is a challenge which is facing. I don't think it's even affecting Limpopo alone. It is one area where I'm saying, as government, working with those that are relevant to the appointment of the bank. They are appointed by the banks because these fleets are being managed by the bank. So we are engaging. We've written letters to those service providers to say if they are not able to meet the demands, they need to indicate so that we can get other service providers who are able to be able to fix and repair the cars. So that is a fact.
All
now,
right.
I was saying, based on that, and after doing all those and understanding, that will not make us to stop procuring ambulance. But we are saying it's like you are fixing, you are transfusing an ectopic pregnancy because you keep on giving the patient blood. But the patient is still bleeding. If you have got a ruptured ectopic pregnancy, you must go and tie the bleed and then give blood, then you'll be fine, the patient will survive. So we also need to look into that particular aspect to say, while we are procuring new ambulance, those other ones must be properly maintained so that we can be able to see progress. So what we did, we audited our stations and we found that we have a challenge. So for this month, we've been able to procure 66. Of those 66, we prioritize the most rural areas where they don't have alternative. You see, when you are in town, in Capricorn District or Petersburg, the advantage of Polokwane town and Petersburg Hospital is that if we are unable to get a public ambulance, you can always get a private. But in the rural areas, the only source of healthcare services is the public healthcare. And that is what the people of this country must remember, that even the day you visit Kruger National Park, if anything happens to you, the nearest facility that will help you is the public health. The nearest ambulance that will respond, so we must do this for ourselves, not saying we are doing it for others. So from the 66, 12 already we have allocated to Malamulele, which service more than 84 villages. So those 12 are already there stationed. We already took 28 to Harachacha. Harachacha, it's an area which is outside. Taking the remaining, the other 12 will be taken to Motsi, which is Philadelphia Hospital. That's where we also seen the need. The financial year is starting. They come this Saturday, which is the 1st of April. We have already made orders for a number of ambulances. What is our plan? We are overhauling the entire EMS services. Right. We are saying each crew meaning the 2 paramedics, they will be allocated their own ambulance, which they must take care of it. when it's damaged, they must be the one who are responsible for it. They must be able to look at after it. So we are not only providing these ambulances, we are also changing how things are done. Responsibility. We are also treating our fleet with an electronic system that will assist the MEC to sit at home and check where is ambulance registration, what. If we see it in a shebeen or being abused, you will know this is an ambulance driven by Oli. So you will know that who to charge and who take accountability. We can't just provide resources without demanding accountability.
MEC, I can't close the conversation without revisiting that August 2022 video. You'll remember that the Member of Parliament from the EFF, Mbuyiseni Ndlozi, laid a complaint at the Health Professions Council against you. The understanding is that you have since been sanctioned. What is that sanction?
I can tell you that I've got a letter from the HPCSA which indicates that they will inform me of the date of the hearing. So I have not appeared in terms of the disciplinary hearing. So can we allow that process to continue? Because that's what I can do, that the regulator probably has been irregular in terms of how they manage this process. I wouldn't want to comment on the matter where I'm sitting with a letter in front of me which says, Dr. Ramathuba, you have a case to answer. We will inform you of the date of the hearing so that you can appear and tell your side of the story. So let's not politicize, and the HPCSA must stay away from politics and regulate the professions who are looking after the patient. So let's allow that process, and I will be able to go in and be able to explain my side of the story. But the reality of the matter is that as a politician, I have to do whatever it takes to make sure that the resources that we have, which are very limited, are able to cater for the healthcare services for the people of Limpopo.
So no sanction against you thus far then?
I can tell you that in terms of the act of the Healthcare Professional Council, I received even a proper letter which informs me that I should be appearing and I will be informed of the date to appear. So I wouldn't want to discuss much. It's them that must answer you as to what did they do and what has happened. Are they playing into political space? I think that is what you need to find out from them.
All right. It looks like that is a very pregnant question you're leaving us with there. Hopefully they will come and explain to us. That's the MEC of Limpopo, Dr. Phophi Ramathuba. And she helps us close the Monday edition of Newsfeed AM. I'll see you again tomorrow at 9. Thanks for watching.